Well, this past week, Governor Mike Beebe and state lawmakers learned that the federal government would be willing to allow Arkansas Medicaid dollars to be used in the forthcoming health insurance exchanges as a way to provide insurance to low-income Arkansans currently uninsured. Does it position health care reform at the Capitol for a needed supermajority of votes? We're going to find out. Joining me to talk politics is Representative John Burris. He is the chairman of the House Public Health Committee. Good to have you with us.
Thank you.
Back on the program.
Yeah, thank you.
We didn't beat you up too bad last time. You felt like you could come back and get a fair shake.
Yeah, I think it's a setup, but we're going to give it a go.
I appreciate it. I want to get your thoughts to capsulize what you think happened this past week. How do you describe what happened with this Medicaid breakthrough?
In short, we finally got some flexibility from the federal government that we had been consistently asking for 6 months. Since the Supreme Court ruling, there was always a question of what options states would have. Health and Human Services on a federal level had always said none to us, and I mean by us meaning Republican legislators in Arkansas. We're not comfortable with that. The debate has consistently been about an all-or-nothing approach, but we were calm and patient and asked for better options, and this week learned that maybe there's one out there. But in a lot of ways, it just it gives a whole new framework to a policy discussion where we're starting from scratch.
Do you think that this is a more cost-effective way to deliver health care in the state of Arkansas, to go through the private exchanges versus the public dollars of Medicaid?
Well, I think it undoubtedly can provide better quality of care to consumers in hopefully a less expensive way to the state government, because, again, the only option previously was expanding Medicaid, which you know very well is facing shortfall year after year after year. The only option previously was expanding what I considered to be a broken program that was on a path to insolvency, and doing it in a way with very tight federal restrictions that probably guaranteed failure. This is completely different. It's a 180 from where we were. It is a conservative, market-based, consumer-friendly option. A lot of questions still to go, but it's definitely a start.
Well, let's ask some of those questions, because one of the things right now, you've got two kind of 800-pound gorillas in terms of the health insurance market in Arkansas: Blue Cross Blue Shield, Qual Choice. Those are your two biggies.
Right.
Does this open up the markets, do you think, if this new population moves in, if this Medicaid money moves over into the health insurance exchanges with that Medicaid population, do we have more competition for health insurance in Arkansas?
I think we have to. You have to have carrier competition, because that guarantees the best prices and the best product for the consumer. I think it's possible now. You're adding a large pool, a very large pool of what have been defined as typically young, working-age adults. They're a healthy population, low utilizers of the system. I think we have a great opportunity to offer more and diverse products on the market than we did before.
Some will argue that this path to going through private insurance exchanges is going to cost more money than it would just a straight-up Medicaid program. How do you answer that criticism?
It's something we have to work through. I don't think anybody knows the definitive answer yet, but Surgeon General Joe Thompson was in the paper today, and Director Seelig, both stating that they thought that there was a greater economic impact to this approach, and that maybe it would be less. I think even Surgeon General Thompson disputed some of the CBO numbers that had been used that people are quoting on whether or not this is more expensive or not. We haven't seen any Arkansas-specific numbers. Again, these are young, working-age adults, low utilizers of the system. I think there's a way to set some definable. So number one, I think that we need to get some Arkansas-specific numbers, because this is an Arkansas-specific plan. But I also think there's a way to save state dollars by transitioning people out of our Medicaid system into a private plan. We need to set some definable targets for reductions in Medicaid enrollment, and also, along with that, personnel and overhead. I think there's a way to reduce what we're doing on Medicaid now and the state's obligation to it, and put people in a private plan where they get better coverage.
You talked about that there's a framework now for a larger policy discussion. So what happens next? What do you guys do up at the Capitol? You obviously will have to negotiate some things with DHS, with the governor, with your own Republican ranks, with Democratic legislators. Tell me how you move the debate forward from where it is today.
I think the process is probably underwhelming if you saw it in person. For 6 months, you've had a group of legislators that have really been dedicated to finding some answers, and I can't speak highly enough about the work that some of our senators and representatives have done. to not just take the federal government's all or nothing approach, to not just say it's a no-brainer and we've got to do it now, to actually plow in and figure out how can we actually develop health care policy that serves the needs of our state. So I think the process that we've been on will continue. We're going to continue meeting with DHS. I think we've developed a very good working relationship with Director Seelig and the Medicaid Director, Andy Allison. We've had productive meetings with the Governor's office. I think we need to continue that and see where we get.
You've been a little bit on a national publicity role here. Wall Street Journal, Politico, probably New York Times, a couple other high-profile, Washington Post, I think, has done an interview with you guys on all of this. What's been the curiosity nationally about this?
I think that it is a fundamental revision of some of the very principal tenets of healthcare reform, ACA. Again, we were told for a long time there was all or nothing. The only answer was expanding a government program. Now that is not the case, and so I think there's a lot of curiosity from the part of other states and then really conservative thinkers across the country that at least want to know if this is a possibility for taking what we and myself included view as flawed legislation with flawed logic of growing government programs that are insolvent and provide low quality of care to maybe doing something better for the expanded pool, but also coupling that with reforms to our current system that will make it solvent. Everybody knows the problems we have with Medicaid, but we haven't really been able to pin down and get the answers. We agreed that the solution wasn't expanding it, but now maybe we have an avenue to fix it. And so those have been the questions that have been asked.
So some things that you're talking about are looking at doing to maybe tighten up the existing program, means testing, for instance?
Yes, absolutely. I think we can do better. We can do a better job of means testing and verifying that people receiving benefits are eligible for the benefits they're receiving. I think we can do better things with monitoring our own, how we're spending dollars, what providers are doing. There's a whole list of things. I think we can do a better job of offering preventative care and managing problems on the front end to make sure that we're not dealing with them on the back end when they're more costly. A whole lot of things that we can do if we segment out these programs and put healthy people into a private exchange or onto a private plan where there's better quality of care and more consumer buy-in and sharing of the product.
Do we revisit the fact that we shot down a state-run health exchange? We now have a state-federal partnership. There's been some talk about going to a full-blown federal health insurance exchange. Does that debate reopen? And what do you think's best?
Well, it's something we have to discuss. I mean, to me, it's very much down the path because we are on the path to a partnership. I don't know that can change. I'm probably comfortable staying on that path now. The issue with the federal exchange was always whether or not it would be sustainable. The problem with the state exchange was whether or not it would be sustainable. The reason the federal exchange was always appealing was because the federal government was assuming the risk for the law that they implemented if it proved to be unsustainable, which in a couple of states it has. With the partnership, we have a little bit of protection if it does prove to be unsustainable, but a minimum amount of input. So I don't view it as directly a part of this debate. Eventually, it probably becomes an issue, but no different than it would because the state can always look back and revisit whether or not it wants to take over full control.
Last question for you. Do you have a supermajority of votes to get this implemented? Do you think it's there now?
Well, we don't have a policy to have a vote on. I just want to stress completely that. In
theory, though, do you think that the mentality is there, that the appetite's there for it?
I think that there was no appetite for Medicaid expansion, which is why we are here today. A supermajority, at least a majority of people said no to expanding a broken government program, and that's why we're sitting here today having this discussion. We need to put together a plan. We need to find out if it can be the plan that we've talked about, a conservative, market-based, consumer-friendly plan that provides the best health care for the people of Arkansas. If we can get that, we might be able to get the votes.